Hello everybody and welcome to the Thursday edition of Video Clips. The first healthcare professional in modern times who thought that food should be used as medicine might have been Jack Geiger. While establishing a community health center in rural Mississippi in the 1960s, he purchased food for his patients and charged it to the center's pharmacy account. Well, as you might imagine, a lot of people questioned his wisdom about this decision, and he responded, quote, "The last time I looked in my textbook, the specific therapy for malnutrition is food." Well, we need more of that. 60 years later, there's more talk about food as medicine, but there are few traditional facilities that have adopted formal policies or programs that really do something about it. An exception is Geisinger Health system, which has a history of implementing innovative strategies. And you might remember, if you've been watching for a long time, I did a video clip on Geisinger, I think it was about a year ago, because they had instituted a practice of refunding money to dissatisfied patients. They think that patients are customers and they should be happy, and if they're not happy, they get their money back. More of that, all right? So it's not surprising that Geisinger decided to try offering food as medicine to targeted populations, and the results have been nothing short of spectacular. The organization began its efforts by targeting diabetes, which affects 11.3% of the Pennsylvania population. It's actually a little worse than the national average. Geisinger started offering fresh food pharmacy with an F instead of a PH, pharmacy, a program that treated healthy food with the same importance that was normally reserved for drugs. The program involves screening for food insecurity, since people who are not food secure are 2 to 3 times more likely to become diabetic than people who are. Once the patients were identified, they were given free nutritious food along with education about how to manage their condition. The program operated under 2 assumptions. One was that healthy eating could improve health, and the other was that a lot of people really do want to improve their health, but they probably just don't know how. The pharmacy with an F, pharmacy, consists of a food pantry and a Geisinger center that provides enough fruit, vegetables, whole grains, and lean protein to feed program participants and their households 2 meals a day, 5 days a week. The families are given recipes and menus which provide guidance about how to use unfamiliar foods and ingredients. Participants are required to take 15 hours of group classes during which they learn more about diabetes, its causes, and how to better manage it. Participants also have access to a team of healthcare professionals, including a physician, dietitian, pharmacist, health coach, and other support personnel. The team helps people to address issues. In addition to the food and education, the team helps people to address issues that could stand in their way of becoming successful with this, like transportation and child care and medication management. Starting with only 6 patients, the program has now grown to include 112 patients and their households, and involves feeding a total of 336 people, a total of 174,720 meals a year. It's funded through a combination of support through Geisinger, some grants, and private contributions. The results have been amazing. During the last 18 months, hemoglobin A1C levels have dropped from an average of 9.6% to 7.5%. Now, to put this in perspective, a diabetic patient taking 2 to 3 medications can expect a drop in A1C levels of between 0.5 and 1.2%. The 2.1% average drop that is expected with food is also expected to decrease the risk of complications and death by 40%. Additionally, fasting glucose dropped by an average of 26.9%, cholesterol by 9.8%, and triglycerides by 16.4%. Many patients have decided on their own to become physically active, even though that wasn't really part of the program, and they've asked for help with issues like quitting smoking. Now, claims data, this is where it really gets interesting, are available for those participants who are insured by the Geisinger Health Plan, and they show that for 27 of the pilot patients, expenses dropped from an average of $240,000 per member per year to $48,000 per member per year. The cost of the program is only $2,400 per patient per year. So we're talking about a return on investment that certainly isn't available in mutual funds or CDs or the stock market in a very short period of time. Most of the actual cost, which is attributed to the management team, would be part of traditional diabetic care anyway, so it's just the extra $2,400 that we're talking about here for the food. Now, the staff has an interesting term for food. They call food the specialty drug for diabetes, and the cost is only $6 per person per week when you boil it all down. There are currently no drugs that have such a profound effect on diabetic patients, but I think one thing we can be pretty certain of is that if were such a drug to be developed, it would cost a lot more than $6 per person per week. The staff sees food as medicine, just like any drug that would be covered by insurance. It just happens to be a whole lot more effective than most drugs. So how's that for an inspirational story to start out our Thursday morning? All right, now the next topic I want to cover, and this will be the beginning of a lot of articles that I'll do on this topic in the next few months, and it's cannabis. You know, cannabis, people would ask me about it over the years, and I have my own opinions about it, but it's illegal. I mean, people would ask me about it, and I'd say it's illegal, and if you're using it, I don't want to know about it. Just we'll stop the conversation there, because this isn't something I want to get involved in. Well, now most states have legalized the use of marijuana for medical purposes. Laws legalizing marijuana for recreational use have been adopted in 8 states and the District of Columbia, and several states have decriminalized the possession of small amounts of it. A growing number of people have access to cannabis, which is increasing use for several purposes, including people self-medicate for some of their conditions. Information about both efficacy and safety is becoming increasingly important. Cannabis is used recreationally by many people. It has been for a long time. And it's often promoted as being safer than alcohol. It promotes relaxation, and it often intensifies sensory experiences, such as listening to music. Cannabinoids impact the same reward systems as alcohol, cocaine, and opioids. Like alcohol, when used in a social setting, it tends to lower inhibitions and make people more talkative and outgoing. Also, like alcohol, cannabis has a negative effect on short-term memory, attention, motor skills, and reaction time. But unlike alcohol, even occasional use can induce anxiety and panic attacks. Now, this is interesting and noteworthy because cannabis is often recommended for psychological issues such as PTSD and anxiety. There's little evidence to support its use for these conditions, and some studies indicate that there are serious side effects when used for psychological conditions. One review concluded that, quote, "There's an alarming lack of high-quality data from which to draw firm conclusions about the efficacy of cannabis for either pain or post-traumatic stress disorder." Even more concerning is a growing body of evidence suggesting that cannabis can increase the risk of developing psychotic disorders for those who are not already suffering from psychological problems. For users who do develop psychosis as a result of cannabis use, the risk of hospitalization is increased, hospitalization is more frequent, and the stays are longer. Psychotic patients who stop using cannabis have the most favorable outcomes, and while those who continue to use high-potency cannabis products have the worst outcomes. Adolescent boys are particularly vulnerable to the negative effects of marijuana. Every year of regular marijuana use results in a 21% increased risk of developing subclinical psychotic symptoms, 133% increased risk of developing paranoia, and a 92% increased risk of having hallucinations. In spite of this, research shows that people with psychosis choose to use cannabis to improve sleep, to reduce anxiety, agitation, and depression. Research supporting the use of cannabis for other conditions is also scant. One review determined that the evidence for the use of cannabis and cannabinoids for Tourette's syndrome, anxiety, PTSD, irritable bowel syndrome, epilepsy, and neurodegenerative symptoms was, quote, limited, insufficient, or absent, end of quote. Studies show that dependence is an issue and that people continue to use cannabis despite experiencing negative consequences. Cannabis addiction is the most common form of illegal drug dependence in the United States, with about 10% of all users becoming addicted at some point in time during 4 to 5 years of regular use. The rate of addiction is quite similar to the rate of addiction for people who use alcohol. The contention that cannabis is safer than alcohol, I think, is simply not true. It's also a misperception that cannabis is safer to smoke than tobacco. Cannabis smokers have a higher risk of respiratory symptoms, acute bronchitis, and lung cancer than people who smoke cigarettes. Now, to be clear, there are some conditions for which cannabis is appropriate and effective. It has been shown to reduce pain, nausea, sleep problems, and lack of appetite in cancer patients, for example. But it is often promoted as having anti-tumor properties for cancer patients, and this is simply not true. It's prompted the FDA to issue a warning back in 2017 to companies that promote cannabis for this use. Cannabis presents a new challenge for health professionals, most of whom know very little about it. For a long time, there really wasn't much reason to study it because it was illegal. But it's almost an inevitable thing that at this point in time, almost everybody in all states is going to have access to it sometime during the next few years. So here's my take on it. It's not as bad as some people say, nor as beneficial as other people promise. Educational programs for both consumers and practitioners are really needed so that informed decisions can be made about its use based on a good risk and benefit profile for each condition, symptom, etc. So you'll be hearing more from me about this in the next few months. I think it's an important topic to cover because of the reasons I mentioned. And so let the learning begin. And for those of you who are concierge members, I'm planning this summer, I think it's this summer or fall, I can't remember which, but it's on the schedule to use a book about, a medical textbook about cannabis for advanced studies, so we can really delve into the topic a lot more. I know that people are interested in this, not only because some of them are thinking of using it for something specific like multiple sclerosis or epilepsy, but many people have family members who are starting to use it and they're concerned, and they should be. All right, that's all for today and all for the week. As usual, pass this on to anybody who you think might enjoy watching it, and I'll be back to you next week with more news.